Hi, my name is Kira Wadecki, and I'll be researching poverty and its impact on women's health, and this is my presentation outline. So, for part one, I'll be discussing the demographics of poverty that is affecting women. I want to talk about how poverty is linked to poor health outcomes, specifically in the US and India. There is disproportionate of the effect of women due to gender inequalities in employment, education, and healthcare access. So to delve deeper a little bit, I want to talk about the prevalence, incidence, and mortality rates. Specifically in the United States, women in low-income groups are at high risk for diabetes, hypertension, cardiovascular diseases, and depression. And maternal mortality rate is 23.8 per 100,000 live births, disproportionately affecting Black and Hispanic women. And as for India, India has one of the highest maternal mortality rates at 103 per 100,000 live births, and over 50,000 of women aged 15 to 49 suffer from anemia due to poor nutrition and limited access to healthcare. Some further research that I want to investigate is the mental health issues that are among impoverished women in both countries and how economic instability worsens access to care. This connects to the barriers of healthcare that I want to talk about. In part two, I'll discuss the demographics of countries. So for the United States, I found the economic disparities, that 12.9% of women live in poverty, and we have government aid with programs like the WIC, which aims to improve nutrition and maternal health. And then as for India, the economic disparities include 21% of women live below the poverty line, and some government aid that provides financial aid for maternal health care. Some further research, I want to explore the different healthcare systems that contribute to their demographics. So for the United States, I'll go into the Medicare and Medicaid, etc. For part three, I'll be discussing the cultural similarities and differences among women. Some similarities I found was that gender inequality is prominent in both countries, and there's disparities in wages, job opportunities, and healthcare access, as well as a stigma that surrounds reproductive health, whether it's a lack of education or taboos around birth control. As for differences, in the US, we have a lot of focus on mental health services, but I want to expand on why access is limited for low-income women. And for India, there are cultural norms that prioritize overall family decisions over women's health, and I want to research the limitations. Other further research I would include is analyzing how the different power hierarchies and cultural taboos prevent women from seeking care in these countries. In part four of my research, I will be talking about the ethical considerations and action. For global and local initiatives in the United States, I will go into detail about Medicaid expansion, community health programs, and nonprofits like Planned Parenthood. As for India, I will go into detail about the National Rural Health Mission and their free maternal health services. And I wanted to talk about ethical challenges, specifically informed consent, where many women lack knowledge about their rights, and resource allocation, where ethical dilemmas in balancing expensive costs and care in underfunded areas are prominent. Some further research to consider is certain case studies of ethical failures in both countries that I would research. Lastly, I will be conducting my summary and conclusions, where I will conclude my findings based on each part, limitations, challenges, and poverty shown in both countries. I would also like to provide possible policy changes, funding, and education opportunities to help reduce health disparities among impoverished women. Lastly, for my outline, I conclude it with a references page where I have the Centers for Disease Control and Prevention, Ministry of Health and Family Welfare, National Family Health Survey, U.S. Census Bureau, World Bank, and World Health Organization. For my final presentation, I intend to find many more, but this is what I used for my outline. So thank you all for listening, and I can't wait to research more.